so on.
Yes.
Is that correct?
Correct. But to be fair, not just that they were that they were performing poorly. It was a once-a-century event, and they were clearly overwhelmed. And I think even if you imagined everything had been working 10 times better, there would still have been very powerful arguments for having specific task forces aimed at specific things.
All right. The inquiry's heard a great deal of evidence about the workings of SAGE, and the majority of that evidence has been received from members of SAGE, its constituent parts. From the viewpoint of number 10, did the SAGE government liaison, the process by which the government received advice from SAGE, work well?
So I think SAGE did a brilliant job at coordinating scientific expertise. I think Patrick Vallance did a brilliant job in chairing it and organising it. But I think that the mechanism whereby SAGE's thought processes were conveyed to number 10 could be radically improved, because they were fundamentally oral briefings from Patrick Vallance and Chris Whitty on the one hand, and the consensus minutes on the other hand, and then often very confused interpretations of what they had heard by officials in the Cabinet Office who did not necessarily have the skills and background and technical understanding to be able to explain those things well to number 10.
Pausing there, just to split those answers up, please, Mr. Cummings, in relation to the reporting system through the Chief Medical Officer and the government's Chief Scientific Advisor, were those briefings by them to government recorded, or were they oral?
What do you mean by recorded? Do you mean minuted?
Well, were they minuted? Did they produce papers in support of everything they said? Or was this funnel of communication largely an oral one?
It was largely an oral one, though, of course, the private secretary would record notes from the meeting and then issue action points and other things in the normal way from the private office.
The SAGE minutes were, as you've described them, consensus documents, and others have described them similarly. Did number 10 get a proper understanding of the width of debate that had taken place before SAGE and of the nuance of these extremely difficult and complex issues?
In my opinion, obviously not. I mean, there's no substitute for actually listening to these conversations oneself and interrogating people. I'm not saying by that the SAGE minutes themselves were a bad product. I think they were a good product and a useful product. But if you're asking about the nature of a crisis like this involving the Prime Minister having to make extraordinary decisions, he obviously needed much richer information than the SAGE minutes could provide.
You are critical in your statement of the way in which the Cabinet Office commissioned work from SAGE, and you say, on occasion, the wrong questions were asked of SAGE. Mm-hmm. You, and we know, I think, Demis Hassabis, your friend, attended SAGE. Why did no one say to SAGE bluntly and plainly, we want you to indicate much more clearly what your recommendations are. We need a much clearer understanding of what you suggest. And this is the government strategy, so that you know to what you should direct your advice.
Well, with respect, it wasn't my job to try and commandeer SAGE and start giving them orders about how they should operate. I spoke privately to Patrick Vallance about things. I suggested, for example, getting some external people like Gowers and Hassabis to attend and listen and review the papers. But it wasn't for a political advisor to start giving SAGE orders about how it should operate.
Well, if you'll allow me to suggest, Mr. Cummings, you weren't just a political advisor. You were in a position to exercise a significant degree of control and power at the heart of number 10. If you saw there was a problem in terms of the route of advice and the communications that you were receiving, why was this not publicly raised?
Well, as you know from the various evidence, I sent Ben Warner to attend the meetings and discuss them. I listened to some of them myself. Also, from the beginning of January, I had at least weekly meetings, sometimes 2 or 3 times a week with Patrick. where I would talk to him myself about about all sorts of things about science, but also obviously as time went on, increasingly about COVID. So I did push on these things, and I did probe, and I did talk to Patrick about them all. My criticism is not of Patrick. I think the fundamental problem was the interface between SAGE, DHSC, and the Cabinet Office. And my point that you refer to in my evidence is, this is not my, I'm not a technical person, so this is not my expertise I'm reflecting. The data people who were extremely smart and able, who came in to help us, they said to me, the Cabinet Office is asking the wrong questions and misinterpreting the answers. And that was a problem both before the first wave and as we emerged out of the first wave.
You asked your friend Ben Warner to attend SAGE.
I did.
You spoke privately to the government's chief scientific advisor, Sir Patrick Vallance. You hadn't held back from making recommendations in relation to structural changes that, in your view, were required to be made to the Cabinet Office, to Number 10, to the DHSC. Why did you not publicly say there is a real problem with the structural route by which SAGE advises the government, and we are not getting a proper understanding of the picture?
Well, I don't think it would have been a good idea for me to say publicly something like that. But I did
to your colleagues in government.
I did say that to colleagues in government. I also spoke to Patrick about making the SAGE. I also had a very strong view that the SAGE minutes and other documentation should be made public in February for scrutiny. And actually, Patrick was very good about that, and Patrick completely agreed. Unfortunately, again, the culture of secrecy in the Cabinet Office blocked that, not just February, March, but actually kept blocking it for, I can't remember how long, but for a very long time.
In your statement, in relation to the issue of the substantive advice you received from SAGE, or rather the advice that the government received from SAGE, you say that it was represented to the government that SAGE was broadly in agreement with the strategy of mitigation, and we'll come back in a moment to look at that in more detail, or Plan A, as you call it.
Yeah.
But that subsequently you were told that SAGE members on the SAGE committee, denied that they had been generally in support of a mitigation strategy.
Yes.
When were you told that that representation of SAGE's position was inaccurate?
I'm not sure exactly, but you could start to see it in what they themselves said after the first lockdown happened. From that point on, a lot of people around SAGE started to talk as if they'd been recommending this for a long time, whereas, as you can all see from the evidence, they weren't even recommending it in the week of the 9th of March.
That was obviously an extremely serious problem. The government's sole scientific advisory group for emergencies was not, it would seem to you, and what you were told, accurately giving you a proper reflection of the debate in that committee.
Well, I wouldn't put it like that. I think actually I would say the problem in lots of ways was actually worse than that.
All right.
That it was represented to us, even in the week of the 9th of March, that that SAGE collectively agreed with the DH plan of single peak herd immunity by September. And indeed, as you can see from the public record on YouTube, many people from SAGE actually gave interviews that week articulating that Plan A strategy.
So, at least after the first wave, Mr. Cummings, it was obvious to you that the information that you had received from SAGE on behalf of the government was to some extent inaccurate. It hadn't been a fair reflection on what you've said of the views of its members. SAGE, you say in your statement, had not made plain that there was a viable alternative to mitigation. They had not made plain, at least until quite late in the day, that the numbers of deaths and hospital cases would be massive.
Sorry, I would. The last sentence is not accurate.
until quite late in the day. When did SAGE tell you that they had concerns that the infection fatality rate and the infection hospitalisation rate would mean an inevitable wave of death and hospital cases?
I don't remember the exact date, but if you look at multiple graphs from Cobra that went through SAGE, you can see that people were envisaging a scale of death that would overwhelm the NHS, certainly in February.
Late February, wasn't it, Mr. Cummings?
I would say early February.
Well, we'll have a look and you can tell us where those documents are. Did SAGE tell you that effectively there was no means of controlling the virus once it had reached the United Kingdom?
I wouldn't say that SAGE told us that. I would say that that number 10 was told that that was the consensus view of CCS in the Cabinet Office and Department of Health and SAGE, that fundamentally, number 10 was told in January and February that the most significant danger that we faced was a second wave happening later in 2020. And that was what everyone was trying to avoid. And that's why the single major peak by September approach was taken.
We'll come back to that doctrinal debate, that strategy. But I'm asking you, Mr. Cummings, why, if it had become apparent to you that you had not been able to understand accurately what SAGE believed, or you had not received a fair reflection on what SAGE was debating and what it thought, why, after the first wave, did you not bring about changes to the SAGE structure and the advisory structure in the way that you had advocated for the Cabinet Office, the DHSC, number 10, the Civil Contingency Secretariat, and so on?
Well, I literally did. I mean, we created the data science team, and part of the whole point of the data science team was that you had actual, very deep technical experts that could red team and explore what SAGE was saying and give the Prime Minister advice on what was coming from SAGE, how to interpret it, potential problems with the advice that was coming from SAGE, etc. And that team actually did that job. Excuse me,
that was data within Downing Street. You set up the 10DS, the 10 data system, or 10 Downing Street data system.
Mm-hmm.
What changes did you advocate or propose in relation to the constitution of SAGE and the means by which it informed government of its advice?
So the main thing that I personally did was to institute the 10DS data science team, because that was the exact appropriate kind of thing that number 10 needed to interpret these scientific and technical questions with skills, with tools that didn't exist at all in January, February, March in number 10 or the Cabinet Office. I did not regard it as my job to tell the SAGE people and Patrick Vallance how to manage SAGE. My view was that number 10 and the Prime Minister's Office critically needed deep technical, scientific and data science skills and tools right at the heart of power that could interpret information coming in not just from SAGE, but from everybody all around the whole system, including Test and Trace, including the Joint Biosecurity Centre, and dozens of other entities.
All right. We're going to move on to a new issue, which is the consideration of vulnerable and at-risk groups in the course of the decision-making between February and the lockdown decision of the 23rd of March. Can you tell the inquiry, please, to what degree the position of vulnerable and at-risk groups was considered by decision-makers in Downing Street during the run-up to the decision to impose a national lockdown?
Could you say exactly what you mean by vulnerable and whatever it was? I'm sorry.
Yes. Persons who would be potentially vulnerable to the impact of a lockdown, members of minority ethnic groups, people who are vulnerable in terms of socioeconomic deprivation, victims of domestic abuse, people for whom there was plainly a case to be made that they would require specific consideration in terms of what the impact of the lockdown decision would be.
I would say that entire question was almost entirely appallingly neglected by the entire planning system. There was effectively no plans or any plan even to get a plan for a lot of that. As you could see from the evidence, one of the most appalling things of the whole enterprise in lots of ways was on the 19th of March when we realised that there was essentially no shielding plan at all, and the Cabinet Office was trying to block us creating a shielding plan. I think there was a brilliant young woman in the number 10 private office called Alexandra Burns who tried to raise warnings about things like wives who are being abused and children in care and a lot of similar things, and I don't think the system ever properly listened to her.
Do you recall when the Prime Minister was advised of the risk of long-term sequelae arising from COVID infection?
So I don't know what sequelae means.
Consequences. So persons who suffered from what is now known as the syndrome long COVID. When was it first understood that there could be long-term health problems, health conditions associated with it?
It was obviously discussed in January in general terms, in the sense of Patrick and Chris and others saying to us, of course, we don't know what the long-term consequences of this might be. They essentially said, there's kind of problem A, how many people it just kills immediately, but then there's problem B, what the long-term health consequences may be. At the moment, obviously, by definition, we've got no data and information on that. So we knew of it as a general problem in January, but it really kind of bubbled up, I would say, but I'm guessing, I'm not sure if that's helpful, in roughly May.
I think in May, the Prime Minister shared on a WhatsApp group with you, the Chief Scientific Advisor, the Chief Medical Officer, you and Matt Hancock WhatsApp group, an FT article entitled Mystery of Prolonged COVID-19 Symptoms. Do you recall that?
Vaguely.
What about the issue of the disproportionate number of deaths in the black and minority ethnic communities?
I mean, it was discussed after the first wave.
When did it first become apparent that there was a disproportionate fatality rate in those communities?
I can't remember, I'd be guessing, but I think the data that came out of the first wave showed that that was an issue.
All right. Preparedness. Much of your statement focuses on your opinion that there had been a critical failure to plan for the type of pandemic which, in the event, ensued, and an absence of critical capabilities, as you describe them. In essence, that in January and February 2020, there was no system, no plan, no structure in place that could have allowed either the borders to be sealed or for any kind of scaled up test and trace process. Dealing with those two aspects in turn, in relation to the borders, the material shows that in Downing Street there was regular reconsideration of what could be done in terms of keeping the virus out of our border. What was the advice that was received from SAGE as to whether or not that would be an efficient or effective process?
It was twofold. First of all, it was that, threefold. First of all, we didn't actually have the capability to do it because obviously Britain has not been able to control its borders for many years. It doesn't have data to do it, doesn't have infrastructure to do it in general, never mind for a pandemic. So, first of all, there wasn't the capability. Second, we were told, even if we had the capability, it would only delay things by a relatively trivial amount. And third, of course, people at that time, the reaction from a lot of people was closing the borders is racist. You remember when the supermodel Caprice said on TV, why aren't we closing the borders? A lot of people, public health experts, mocked her as if she was an idiot. That was the prevailing conventional wisdom from the public health system, and was reflected, the dismissal of Caprice, I would say, was reflected in number 10 by the public health system. And of course, if you're going for a single wave herd immunity by September fundamental strategy, then faffing around at the borders wasn't regarded as relevant or coherent with such a strategy.
By that, do you mean if the strategy of the government was to accept that by mitigating the worst severity of that first wave of the virus and thereby allowing a proportion of the population to become infected nevertheless, there was no point in trying to shut our borders because part of that strategy entailed allowing part of the population to become infected. Is that
Correct. That's what the Prime Minister and I were told. Yeah.
But SAGE and NervTag specifically advised the government against border screening because they took the view that it would be ineffective. You can't test in the absence of a testing system for asymptomatic patients. You can conceal your symptoms. You may even become infected on a plane and no symptoms will show until after you've arrived. So did the government not appreciate that in practical terms, such a step would be extremely difficult to put into practice?
Well, yes, we would I'm not sure if I've misunderstood, but one of us has misunderstood. We were told that it was impossible. We were told the British state couldn't do it in January. We didn't have the infrastructure to do it. They didn't have the tests to do it. Didn't have any of the things that you need to do it to control the border. But at the same time, it wasn't regarded as a big problem, given that people didn't want to control the border anyway.
Is that fair, Mr. Cummings? SAGE and NervTag produced papers which were sent to the government and which you presumably saw, setting out why in practice screening, restrictions, or even an elemental quarantine system would not work in practice. It wasn't a doctrinal position, was it?
No, well, I think that obviously if you're just saying, do you actually control the borders, does that solve the problem? Of course the answer is no. And if you're looking at just at the specific issue of what the effect of controlling the borders would be, then of course the answer is clear, and what SAGE and NervTag said makes sense. But that's obviously not the real question. The real question is, should you have the capabilities like Singapore or Taiwan to combine actual serious border control with a domestic test and trace regime and the data to support it and all the other things you need to support it, and then roll out mass testing? If you had the capability to do that, which I very strongly suggest this country ought to acquire, then obviously controlling the borders is a critical issue.
Mr. Cummings, without a scaled up test, trace, contact, isolate system, shutting the borders will not suffice on
Correct.
itself. So the problem here was not that there was a doctrinal decision not to consider shutting the borders. It was that in practice it would do no good, and without a test, trace, contact, isolate system, and there was none, it would never work.
Correct.
Is that the nub of the issue?
It's half of the nub of the issue, but the other half of the nub is that if you regard the whole thing in a fatalistic way anyway, which DH and the Cabinet Office and SAGE did at the beginning, and you think that there is no effective alternative to herd immunity, if you say that at an overall conceptual level, there's either A, shape a curve towards herd immunity, or B, try to build your way out of the problem. The entire system in January, February, early March thought that the only plausible approach to this was to shape the curve of herd immunity. No one thought it was really practical to build our way out of the problem. The fundamental U-turn that we shifted to was to try and build our way out of it instead of fatalistically accepting.
The material shows that you spent a great deal of time in April, May, June, trying to get on top of the test problem.
Yeah.
At what point in January and February, or indeed even March, did the penny drop in the government that the absence of a scaled up or significant test and trace system effectively meant there was no means of controlling the virus once it had reached the United Kingdom?
Well, of course, until the week of the 9th of March, the entire system was just sort of rolling along the single peak strategy by September. And there were conversations and references before that week to, we've obviously got to do more testing. But that wasn't that was more just sort of, we need more tests for the NHS and maybe a few thousand and blah, blah, blah. It wasn't conceived, testing wasn't conceived at the end of February, beginning of March, in the context that it would be seen in April, May, June, i.e. scaling to hundreds of thousands, then millions, then potentially tens of millions. I think what really brought it home, certainly to me in the PM, was when we were suddenly told in that week of the 9th, and it was one of the things that involved pennies dropping, that essentially testing had been stopped.
12th of March.
Yes, if you say so. I mean, it was around then.
And so that we can understand the importance of this issue, is it your position that if there had been a sophisticated, competent system for test, trace, isolate in existence or brought into existence in January, February, March, and other countries, the inquiry is aware, did precisely that. South Korea is a very good example. It may not have been necessary to go the whole hog and to mandate the imposition of a national lockdown, because the means of controlling the virus would have been at hand with the test and trace system, and therefore no need to control it with a lockdown.
Yes, my view is that what ought to have happened is that as soon as the first reports came at the end of December, on roughly New Year's Eve 2019, we should have immediately closed down flights to China. We should immediately have had a very, very hardcore system at the airports and borders. And there should have been a whole massive testing infrastructure ramping up, both for test and trace in a kind of conventional sense, but also a manufacturing and industrial capacity system to manufacture the rapid tests at scale. I mean massive scale of tens of millions a week. I think if you'd had that combination of actual serious border control and this country for the first time ever actually controlling its borders and taking it seriously with test and trace, and then a kind of out of the box, here's how you massively scale rapid testing, and you put all of those things together, brackets arguably also with human challenge trials on vaccines, close brackets, then I think in retrospect that's clearly would have been a much better approach, not just in terms of deaths, but also in terms of us being able to keep open the economy, to a massively greater extent than we were able to. So it would have been better in both ways.
You say, Mr. Cummings, in retrospect, no one, not even you, with your keenness to ensure that the government system could be made to work efficiently, appreciated in February, March, that without such a scaled-up test and trace system, the options for the United Kingdom government were going to be extremely limited indeed.
So I wouldn't quite put it like that. We did appreciate that we didn't have these things. And there are, as you can see, there are references from me to Singapore and whatnot in multiple groups and emails and whatnot. And people like Mark Warner were saying to me, why is there just this fatalism on the subject?
Slow down.
So we were aware of it.
But nothing could be done.
But it was all obviously too late. You can't just pull a system like this out of thin air in a few days.
Conceptually, doctrinally, the British government's position in February and the early part of March had been viruses come in waves. In order to ensure that the first wave doesn't strike us during the winter months, the best policy is to mitigate it, to take the top off, delay it so it's closer to the summer, and that way we'll avoid the risk of that wave, if it is completely suppressed, recoiling like an uncoiled spring later in the year with a devastating second wave. Plan A. Why was it not appreciated after March and April and the first wave that such a test and trace system would avoid the risk of a second devastating wave?
Well, with respect, I think it was appreciated, certainly in parts of the system. I mean, you can see I wrote it on whiteboards around about the 13th, 14th of March as part of shifting to Plan B. So, so people in Department of Health and elsewhere were building up testing in February, early March. There were plans to do that, but they were not thinking at that time about test and trace. Once we made this flip, around about the 13th to the 15th, I talked to the PM about it on Saturday the 14th of March, and Vallance and I talked to the PM about it on Sunday the 15th of March as part of this different conceptual approach of building our way out of the problem.
You misunderstand me. During that first stage with Plan A, with mitigation, the argument being put against suppression was it'll recoil like an uncoiled spring with a devastating second wave. If you push the first wave down, it'll spring back.
Yes.
So before the change in strategy, why was it not understood, well, don't worry, we will deal with the first wave, but by the time the second wave comes along, if it does recoil like an uncoiled spring, we can deal with it with a proper test and trace system? Why wasn't that debate had when the government was still in the first strategic response?
So if you're asking why were we not talking about test and trace before roughly, say, the 13th of March, yes, the answer is because no one, before, remember, in the first time that there was no plan for lockdown at all in the week of the 9th. The plans for lockdown only came after we started to change. So there was no... The whole point of the problem up to the week of the 9th was that the whole system fatalistically thought there was no way you could possibly do a lockdown in Britain. It was thought of as the completely crazy idea. So, of course, people were not thinking, well, let's do lockdown and then build test and trace. Everyone thought, well, we obviously can't do lockdown, and lockdown's mad because it will all come back.
But they were thinking about, and they were advocating, suppression. That is to say, the squashing down completely of a first wave.
No, sorry, no. Who do you think was arguing for that?
The one-wave strategy, Mr. Cummings, envisaged a mitigation, and then this argument arose as to whether or not a suppression strategy, which allowed the wave to recoil, the spring to uncoil, would result in a second devastating wave. So why was there not a debate about what could be done to prevent that second wave? Why was it not thought about?
Well, I think I'm not quite. Possibly I'm confused by your language. I don't know. I'm not quite understanding your question. But I'll try and put it this way. Up to and including the week of the 9th, the assumption was that, so you're suggesting there was some great debate. The whole point was there wasn't a debate. There was an assumption across government, across the Cabinet Office, Department of Health, and SAGE, that lockdown was impossible in a Western country. Anyway, we didn't have all of the things that you needed in place to actually do it. You didn't have test and trace and whatnot that you'd need to have afterwards. That vaccines were almost definitely not going to have any impact, at least in 2020 and possibly never. So the whole point was that up to and including the week of the 9th, that the debate you keep referring to, there wasn't a debate. That was the whole problem. There wasn't a debate about the fundamental assumptions underlying Plan A. There wasn't a debate until me and others started saying, hang on a second, if you actually follow the logic of what Plan A is, it's going to be a catastrophe. And we have to ask these questions and we have to consider an alternative Plan B. But before that, there was no debate about this. It was just assumed.
There was a debate at the scientific level between mitigation and suppression. But it may be that that debate and the merits of mitigation versus suppression simply didn't reach your level in government.
Well,
and that you weren't aware the scientists were debating the pros and cons of mitigation versus suppression.
Of course, it was discussed by people, but as you can see in all of the SAGE, in all of the SAGE and DH documents, the assumption from everybody was that it was simply completely impractical, and everyone was still on the mindset of a flu pandemic. So, of course, there were debates, in one sense going on, and there were scientists, et cetera, et cetera. But the core of what we were presented with in number 10 was there is unanimity between the Cabinet Office, Department of Health and SAGE behind the propositions that the real danger is a second wave in the winter, and therefore you have to manage a single peak strategy so there's herd immunity by September. That was the core argument that we were presented with. And that was never really proper. The first time I actually really saw that being tested was on the 18th of March when Demis Hassabis said to SAGE, essentially, I think this whole plan is mad and you should immediately lock down, like now, this hour, tell the PM to do it immediately. And that kicked off various discussions.
And the consequence of the absence of debate, the failure to consider any alternative, the failure to consider strategic options other than mitigation and squash the sombrero, was that there was a woeful absence of plan, any sort of written document for dealing with controlling borders, protecting care homes, shielding, quarantine.
Correct. I mean, I would say it's actually worse than that, and sort of doubly ironic, because if Plan A had been what ended up being Plan B, i.e., we'd actually got on top of it and controlled it, and you had a test and trace infrastructure and everything else, then there would actually be a much stronger argument for saying, well, a lot of the shielding stuff we don't need, a lot of this we don't need, a lot of that we don't need, because we've actually controlled the virus.
Mr. Cummings, please slow down. You're making it extremely difficult to record your evidence. And to be fair...
Well, sorry, just to finish that point, because it's important. The situation is worse than what you're describing, because if you are not going to control the virus, if you are not going to have test and trace, if you are just going to have single peak herd immunity by September, it actually makes the lack of a plan for shielding and care homes and everything else even more crackers. Do you see my point?
Yes. And to be fair, you texted Mr. Hancock on the 23rd of January about the existence, the whereabouts of pandemic plans and preparations. I think you asked to what extent have you investigated preparations for something terrible like Ebola or flu pandemic, and you were reassured that there were full plans up to and including pandemic levels prepped and refreshed. It became obvious, and it's obvious from your statement, that you appreciated that there were no plans of the type that you've described. By the middle of March, so 16th of March, a week before the national lockdown, had number 10 still been provided, or had it been provided in any way, with departmental plans, Cabinet Office plans from line departments dealing with these various aspects of a coronavirus pandemic?
Essentially, no. There were odd dribs and drabs came in. You can see from various evidence of texts and emails from me. After talking to Hancock, I pushed on some of these things through February. Imran did as well from private office. But we gradually became aware through the course of February that essentially what Hancock had told me on the 25th, sorry, correction just on the date, by the way, the inquiry and I have wrongly changed the date from the 25th to the 23rd of that text message. So my statement is now wrong, but it should be 25th, but we'll correct that afterwards. But yes, during the course of the 25th, the course of February, we realised gradually as we pushed and probed and asked questions for these plans that they fundamentally didn't exist. And on the 16th, I think you're probably referring to a shocking email in number 10 that says, essentially, the Civil Contingency Secretariat says that these plans are not even held centrally at all. So it turned out, to our horror, that the system that we'd been told repeatedly in number 10, trust the system, SPAD shouldn't get involved, world leading, best prepared in the world, blah, blah, blah. It then turned out that this supposedly brilliant system, the Civil Contingency Secretariat, had not even seen these documents at that time because they were not held centrally, which was I mean, when that email was circulated, people thought it was almost like a spoof.
All right. Well, in fact, we do have, of course, your text message to Matt Hancock in his reply. Your very own letter and statement have a screenshot, and it shows the 23rd of January. It says in terms 23rd of January 2020.
It does. The reason for that is...
To what extent have you investigated?
It does. The reason for that is I was told by the inquiry I got the date wrong and I should change it from the 25th to 23rd. But I actually checked it and it should be the 25th.
Don't trouble yourself. Your own screenshot provides the date of the 23rd of January 2020. So there were a number of COBRA meetings at the end of January and the beginning of February. I want to ask you about an important COBRA meeting on the 5th of February, 56215. Page 1 sets out the ministers who attended. Page 2, the officials and those who dialed in. And we can see that on behalf of number 10, Imran Shafi attended, along with Sir Ed Lister. Page 3, the attendees in terms of the chief medical officers. Page 5, paragraph 2, the CMO provides an update to COBRA, providing information about the number of individuals who had died and how long they had been in hospital before they died. This is all to do, of course, with cases abroad, and particularly China. The two most high-risk groups appear to be the elderly and those with pre-existing illnesses. If you could scroll back out, page 6, between paragraphs 9 and 11, there was a debate about planning for a reasonable worst-case scenario. And the director of the Civil Contingency Secretariat sets out the planning priorities for the work underway to develop planning assumptions for the pandemic flu reasonable worst-case scenario. There was then a debate about communication strategy, an emergency bill, and work with local resilience forums. On this day, or the day after, you sent a text to a WhatsApp group, the number 10 Action WhatsApp group, saying, the chief scientist told me today it's probably out of control now and will sweep world. Were you aware of the tenor of the debate and what was being discussed in COBRA on the 5th of February?
Probably. I mean, I don't remember that particular. All of these meetings now, I'm afraid, blur into one another.
Had you seen this minute of the 5th of February COBRA, you would immediately have understood that the thinking expressed in this meeting was not that which you had been told, which was to the effect that the virus was probably out of control now and will sweep the world. Did that not concern you?
Yes.
What did you do around the 5th and 6th of February to say, this COBRA appears to be proceeding on an incomplete, inaccurate basis? It isn't reflecting what I understand to be the reality, which is that the virus is probably out of control and will sweep the world.
So I can't remember obviously now it's 3 years ago. I can't remember the exact days and whatnot, but around this time, so I spoke to Patrick before obviously that text was sent. I spoke to Patrick again. I probably spoke to him each day, actually, 5th, 6th, 7th. We had a conversation about this and about the briefing of the PM. Patrick and I agreed that we thought the PM had not been sufficiently briefed on a lot of this, on these questions, and we were concerned about it. And we agreed that I would fix up for there to be a meeting as soon as possible with the PM in his office, and that meeting happened on, I mean, it'll be in the documents, I can't remember exactly when, but very, very shortly after this. I think Patrick said to me something like, you know, this needs to happen straight away. It's possible that that was the Friday, and I think I organised it for the Monday, but my recollection of the exact dates could be a bit off.
There was a meeting on the 10th of February
Is that the Monday?
10:45 and 11:15. That could possibly be a Monday or maybe a Tuesday, so that would fit with what you've said. There was another COBRA meeting on the 18th of February, 56227, pages 1 to 3 give us the attendees, and page 5 gives us a sense of what was being discussed. Repatriation of British nationals, and then over the page, legislation, a debate about the drawing up of a bill to be employed in a reasonable worst-case scenario, and then over the page, please, page 7. Planning for a reasonable worst-case scenario, next phase. The Civil Contingency Secretariat said there was work to be done to create a clear plan of activity from the moment of sustained transmission to its estimated peak. Was there an understanding in number 10 that a debate about repatriation and the drawing up of appropriate legislation and the drawing up of plans to deal with a reasonable worst-case scenario did not really reflect what needed to be done in response to the information that was then available?
Certainly by some of us in number 10 at that time, there was, yes. But remember, an awful lot of the senior people in the centre of Whitehall were off on holiday at this time.
The Prime Minister, the evidence shows, received a note in his box on the 30th of January, around about the same time, about coronavirus. He expressed the view on the 31st of January that he wanted to spend more time discussing issues with ministers, and then he received an update on the 3rd of February from the Civil Contingency Secretariat. There was then an email with an update on the 8th of February, and the meeting on the 10th of February to which you have referred. We'll just have a look at the diary for that, 136739. This is the diary for the Prime Minister between the 10th of February and Friday the 14th of February. On the 10th of February, so you're right, it's a Monday, 10:45 to 11:15, coronavirus update. Before he went to Cheveney, which he did on the 14th of February, he received a note in his box, 136743, page 4. Coronavirus international response. Containment of the virus in China is a key part of preventing the spread of the outbreak to the United Kingdom. If what you were told by the chief scientist was right, the chief scientific advisor was right, Mr. Cummings, that there was an inevitability or a probable inevitability to the virus sweeping the world, then any debate about whether or not the virus could be contained in China was out of date. Why was the Prime Minister not told? Evidence is now emerging that this virus is out of control and will likely sweep the world, and debate about international repatriation and drafting of legislation and doctrinal identification of reasonable worst-case scenarios is behind us. We need to deal with that loss of control.
Well, I think there was still an awful lot of. So at the meeting that Patrick and I asked for on the 10th, from memory, these things were discussed. But remember, at that point, it was still not at all seen in Whitehall like this is going to be. Nobody really in Whitehall thought that a month from now we're going to be in the biggest crisis the country's seen since 1945. The view was much more that if this is really going to happen, It's not going to happen for months. And you can see repeated references in documents to number 10 and the Prime Minister that refer to, well, if there is sustained community transmission in Britain, then the crisis will come sort of 2 or 3 months after, which is repeated in various documents. I remember at this point, although there was, in fact, we now know, sustained transmission in this country at that time, that was not known then. So the whole system was, at this point, and not just now, but 3 weeks after this point, still thinking of this as something that was going to land on people in May, June, not something that was going to overwhelm everybody in mid-March.
You had sent a text to the Number 10 Action WhatsApp group on the 6th of February saying, the chief scientist told me today it's probably out of control now and will sweep the world. Mm-hmm. You plainly told the other communicants to that WhatsApp group of what you had been told by the chief scientist.
Yeah.
But during this next week, before the Prime Minister departed for Cheveney, why was that message not being re-communicated to him in notes that were sent to him? Why was he not being told in this note, well, the chief scientist's view is probably going to sweep the world. It's coming.
Well, I think it was just part of the general view from the Department of Health and the Cabinet Office that this was all still, murky and in the future. They weren't banging alarm bells at this point. Far from it. They were going skiing.
Why weren't you, though, Mr. Cummings? You were the one who had spoken to the chief scientist or received a text from him.
Well, as you can see, I spoke to the chief scientist on multiple occasions, and I organised a meeting for him and Whitty to come in and talk to the PM and as they requested. In
the notes that went to the Prime Minister around the same time, why did you, as his advisor, perhaps chief advisor, not tell him, my information is containment has failed, the virus is coming? Well,
I did tell him that.
It's not here.
Well, the fact that things are not written down doesn't mean that they weren't communicated. Obviously, I was talking to the Prime Minister about all sorts of things all the time. And things that as I said, I was having repeated conversations with Patrick, many of which are not actually recorded in diaries from early January onwards. So lots of things like this I passed on. But overall, as you can see, the system was not in emergency mode at this time.
Do you accept that there is no formal communication to the Prime Minister from anybody at this stage saying the information from the Chief Scientist is to the effect that containment has likely failed?
I mean, you have the documents, not me, so I'm sure if you say so, I'm sure that's right.
And then the Prime Minister went to Cheveney.
If you're moving
yes.
on, Mr. Keith, I think probably time for a break. Sorry to interrupt. 3:15, please.
All rise.
Mr Keith.
So, Mr Cummings, by the 17th of February, some members of SPI-MO and SAGE were reporting the belief that there was already sustained transmission in the United Kingdom. On the 21st of February, news emerged of a cluster of locally transmitted cases in Lombardy in Italy, and a lockdown began there, you'll recall, of a number of municipalities. And on the 23rd of February, the DHSC reported 13 cases in the United Kingdom. The paperwork shows that the pace of the government tempo, the tempo of work in government, declined notably between the 14th of February and the 24th of February, which coincidentally is half term. Why was that?
I think it was a combination of, as I said earlier, the general perception of the senior people handling this in the Cabinet Office, DH, at the time, was that if this proved to be a big problem, and it still was an if, then it was seen as really quite a distant problem. It was not seen as an emergency crisis. And secondly, as you remark, I did not go on holiday, but many of the senior people were on holiday during that time, including the PM.
There was no COBRA between the 18th of February and the 26th of February, was there?
Don't know.
There were no cabinets. There were no cabinet meetings during that time, do you recall?
Don't recall.
There were no notes sent to the Prime Minister or emails between the 14th of February and the 24th of February.
I find that, I think that's more likely to be a gap in the paperwork than reflecting reality.
In relation to coronavirus?
Don't know.
He went to Cheveney on the 14th of February. He returned to Downing Street 3 times for work. His diary shows that there were a handful of meetings while he was in Cheveney. But he received from his team in Downing Street absolutely nothing in relation to coronavirus between the 14th of February and the 24th of February. You were part of that team. Why was he not kept in the loop in relation to the developing crisis? Well,
partly for the reasons I've already said. It wasn't seen as an imminent crisis in the Cabinet Office and by the Cabinet, by the systems responsible for dealing with crises. When he did briefly reappear for meetings, or for example on the meltdown in the Home Office, Imran and I did talk to him about coronavirus, and we did try and get into his head that this was a growing problem and had not gone away.
You say there was a lack of understanding that there was a crisis. You had received text messages or information yourself that the virus was probably out of control. COBRA had been reporting that there was now clear evidence of sustained transmission outside China. You knew, and Number 10 knew, that the virus had exploded in Italy. And you knew there were cases already in the United Kingdom. How can it possibly have been thought that there was no crisis?
Well, as I said, round about when the Prime Minister went away on holiday after the reshuffle, around about sort of 13th, 14th, 13th, 14th of February looked very, very different to 28th of February. So things evolved a lot over that period of time. You are, of course, I mean, your fundamental point is obviously correct, that there was indeed a massive crisis. It was indeed pretty insane that so many of the senior people were away on holiday at that time. But it's also important to realise that it's not like the Civil Contingencies Secretariat or the National Security Council or any of the organisations in charge of this were beating the drum and saying, we've got to get the PM back, this is a massive crisis. In fact, quite the opposite. As Patrick Vallance and others have pointed out, but apart from me, the NSC and other things were treating it like the rest of Whitehall was. Like, maybe this will be a big problem, but if it is, it's going to be in May or June.
If it was insane, as you've described it, for them to be away, to be on holiday, or whatever everybody was doing, and for there to be a complete absence of administrative push in relation to coronavirus during that 10-day period, why weren't you banging on the metaphorical door of Cheveney saying, you've got to come back? We have a crisis. This virus is about to overrun us.
Well, I was talking to all sorts of people in that period. I was not on holiday, and I was pushing and talking to Patrick and other people. But I did not regard, and neither did other people, we did not think that asking the PM to come back and talk to Cobra or Whitehall in general at that point would have been productive. In fact, I thought it would have been counterproductive, because I thought he would have said to everybody what he thought at the time, which was, this is another swine flu, it's all another rubbish media hoax, nothing will happen, blah, 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 blah. The real danger is the economy getting talked into a slump. I thought that if he came back from Cheveney and said that to Cobra or to any other part of government, it would be counterproductive rather than helpful.
So are you saying you did actively consider the possibility of asking him to come back and talk to Cobra or Whitehall?
Yes, it was discussed while he was away.
With who?
I discussed it with Imran and I discussed it with Martin and others in number 10.
Is there any record or any note whatsoever of that debate, Mr. Cummings?
Don't know.
Are you surprised to hear that there is no note, as far as we can tell, of asking the Prime Minister to come back and take charge of the crisis?
No, not surprising, because there were conversations. It wasn't, there was people all in the same, sitting next to each other at work.
Well, you're not averse to sending WhatsApps and texts 24 hours a day, Mr. Cummings.
No, I'm not. But as I say, I was sitting right next to Martin and Imran. I didn't have to. This was conversations that we had around the office at that time.
INQ 236371, WhatsApp messages, number 10 action, page 47, on the 27th of February, after his return from Cheveney. Mr. Johnson said, in response to a suggestion from Lee Kane, I think a Monday coronavirus Cobra meeting with the Prime Minister as chair, very important to show grip, suggested to Martin Reynolds earlier, so think he's handling. Dominic Cummings, yeah, we should pencil in an interview early next week on this too. We've got to sort stuff out over the next few days, but Monday must be a new level. And Mr. Johnson says at the end of this particular thread, not sure if it can wait till Monday. There's no reference there to the possibility that he'd been asked to come back earlier, or that there should be a Cobra while he was in Cheveney. Is there?
No.
And he asked, or he said, I'm not convinced we're showing grip on Corona. We need to have a Cobra. Not sure it can wait until Monday. There had been 4 Cobras already, had there not?
I don't know how many there'd been.
Well, you know that there were 4 or 5 Cobras up to that point.
Yeah, something like that.
But he had hitherto not shown any inclination to take a grip by chairing a Cobra himself.
Correct.
On page 48...
Nor was, to be fair to him, nor was the system generally pushing him to.
Well, your evidence is that you might not have wanted him to chair a Cobra in any event because you were fearful for what he might say.
Correct, but I would say that's unofficial conversations. My point was the official system wasn't pushing him to try and do a Cobra, as far as I recall. But we also weren't trying to push the official system to do it because we were fearful that it would actually be counterproductive.
So you were in part responsible for him not having chaired Cobra hitherto.
That's a funny interpretation to put on it, but...
Well, you didn't want him to. You were fearful of what he might do if he was allowed to chair Cobra.
As I said, the system wasn't pushing him to, and I didn't think it was wise to try and force the system to change its mind. I thought it would be counterproductive.
On page 48, one further page on, please. You return to your usual theme of Mr. Hancock. is a know-nothing on comms, and he's totally failed with the Corona comms team. I'm having to convene meetings to sort shit out this afternoon. Mr. Johnson asked for a conference call at 5. Could you scroll back out, please? At the bottom of the page, Lee Kane, can we have a PM update call today? Mr. Johnson, frankly, there is no limit to the stuff I'm willing to do to show we are gripping this. By this time, Mr. Cummings, it was becoming apparent that there was a complete absence of planning or of significant plans. There had been, well, it was evident that there was no means of controlling the spread of the virus once it had reached the United Kingdom. It was plain that there was sustained community transmission from the number of cases the DHC were reporting by the end of February. Why was the Prime Minister left in a position in which only now he was saying there's nothing I won't do to try to get a grip on this crisis?
Well, I think I've already explained a few, the fundamentals of this. The system didn't regard it as a crisis while he was on holiday. The system didn't push him to come back from his holiday. However, in the last week of February, everything started to move dramatically differently. As you referred to, everything kind of kicked off in northern Italy. And crucial in terms of the PM, the media suddenly were all over this, and it was suddenly dominating. And that meant that Whitehall in general then shifted. We in Number 10 were starting to realise that all sorts of things were problematic. For example, PHE, the agency in charge of, nominally in charge of dealing with this, had come to Number 10 and to me asking for help with the communications plan for coronavirus. That's what that reference was to regarding Hancock and Co. So we were starting to, and also, as you know, there's an email from that on the 25th of February, I was saying, where are all of these red teams? Where's all of this testing and whatnot that Hancock promised us existed? Where are these documents? And we, Number 10, was starting to get a feel for the absence of things and a feel for the fact that the first wave of all the communications plans was a nightmare, etc.
Mr. Cummings, you say the system didn't push him to come back. The system didn't regard it as a crisis. The system didn't do that. But you were part of the system. Why weren't you pushing for these things?
Pushing for what?
For him to come back and take a grip on the crisis.
I've already explained that I regarded him coming back at a time when the system was not pushing him to say this is a crisis. If he'd come back on the 15th of February, he'd have said what he'd already been saying in the previous 10 days, which is, this is all balls, it's all swine flu, the real danger is the economy, blah, 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 blah. So that would have been, to me, highly counterproductive, given that me and Patrick and others were very worried about it. Of course, these things are a very fine balancing act. And you can see the problems we had on this with the handshaking, which happened, roughly at this time, where I tried to push him on handshaking, and then it completely boomeranged. So we had to be very careful in how we handled this nightmare problem.
You say that there was a step change, or rather the system changed direction in the first week in March. But the government published on the 2nd of March a coronavirus action plan, contain, delay, mitigate, which was described by Mr. Warner in an email to you and others that it wasn't a plan, it was a communication framework.
Yeah.
You understood perfectly well that it wasn't much of a plan, it was a comms plan, if it was anything. Did you alert people to the fact that a plan for contain, delay, mitigate was likely to be of little use, given that containment had already failed?
There were certainly, at this time, growing conversations, this time, i.e. when this plan was published. As you refer to, Ben Warner was immediately astonished when he saw this document. Other people in Number 10, similarly Imran and others. And this contributed to our growing sense that, hang on a second, we've been told that we're the best prepared in the world. We've been told that all of these things exist. This document is obviously pretty much a joke. like, what the hell is going on? So yes, at that time, there was an exponential curve of the virus, but there was also an exponential curve of alarm in the PM's office and elsewhere in the system.
Where are the emails from you saying, as the chief advisor of the Prime Minister, our sole and primary coronavirus action plan, contain, delay, mitigate, is a joke?
I don't know if there are such emails.
During the course of that week, more and more evidence came to light, both of the spread of the virus in Italy, which had increased fivefold. More measures were proposed to combat the spread of COVID in the Lombardy and other northern provinces. And as you've described in your statement, Mark Warner and you debate on the 7th of March your incipient concerns about Plan A. On the 10th of March, so a matter of days after your concern had started to emerge about the whole strategic direction that the government had embarked upon, the Civil Contingency Secretariat prepared a note, 49583, in which the director of the CCS stated in paragraph 1, COVID-19 looks increasingly likely to become a global pandemic, although this is not yet fully certain. The note sets out the views of the CCS as to the need to have fast-track legislation to effectively manage the outbreak. It deals with excess death management and the need for plans to be drawn up. Did you or anybody else push back against this document and say, it is absurd to believe that a COVID-19 global pandemic is not yet fully certain, given the concerns that you were beginning to have?
Yes, throughout this 9th of March is the Monday. Throughout this week, as you say, having spoken to Mark and others over the weekend and over the previous week, as you can see from multiple messages from this day onwards, I was very concerned, and this document also was one of many documents that appeared at that time that seemed to some of us in Number 10 to make clear that the system was miles off the pace.
Because they no longer, they simply didn't reflect the change in thinking or the emerging understanding as to how far the virus had spread and the absence of means to control it.
Also, I think a really crucial and underrated aspect is the speed. You know, one of the things that's very striking looking back, preparing for this, is how even in the week of, even when you go forward a week to the 16th, and indeed even if you go forward another week to the 23rd, the week of the lockdown, there are still documents repeatedly coming through from CCS and COBRA and the Cabinet Office showing the crisis peaking in end of May, beginning of June. And I think this is really critical to understand. The fact that that was still on graphs in the week of the 26th is genuinely astonishing in retrospect, because of course it's completely false. What a critical thing at this point on the 9th was that partly because Mark Warner, at this point, he had his data team embedded with the NHS, and they were getting better and better data out of the NHS. This is the period when we in Number 10, to some extent, started to short-circuit the Cabinet Office system and CCS, because we were getting information directly from the NHS. And we started to realise, hang on, there is a fundamental mismatch between the shape of the curve that's coming out of these graphs coming from COBRA and the Cabinet Office, peaking at the end of May, June, and the information that we're getting from the NHS, which is showing that the crisis is almost upon us. So this was increasingly alarming all the way through this. On the 9th, I think it was, I asked Imran, again, this was not supposed to be a job for SPADS and it was not supposed to be a job for Number 10. And I said to Imran, please get in touch with Simon Stevens' office and get data directly from Stevens' office to here so that we can see what they're talking about. You can also see chatter between Warner and Patrick on this exact subject.
Pause there. That's a very long answer. I'm going to ask you about Ben Warner. He received an email from Professor Neil Ferguson on the 10th of March in which Professor Ferguson asked him to show or to distribute to the Prime Minister and Cabinet documents relating to the surge demand and daily number of deaths that were likely. So that was another source of information coming into number 10 at that time.
Yeah.
On the 10th of March, the Cheltenham Festival commenced. And on the same day, Public Health England data presented at SAGE suggested that the true number of cases in the United Kingdom, what was to be measured in the tens of thousands. Professor Ferguson challenged number 10 officials at that SAGE meeting and asked them, do you know what an epidemic with 4,000 to 6,000 deaths per day would feel like? What was the reaction in number 10 when that information was relayed back to you?
Well, it contributed to our growing sense that something had gone horrifically wrong in the communication between SAGE, DHSC, and the Cabinet Office about not just the scale of the problem, but the speed of the problem.
Was there then a reconsideration of the wisdom of allowing mass gatherings to continue?
It was discussed in the context of the Cheltenham event, but again, the PM was advised at the time that banning mass events would. So what the PM was actually told at that time was, if you ban mass events, PM, then people will just go to pubs instead, and that will be even worse. Of course, now the obvious question is, but why are they all going to pubs? But remember, there was no plan for lockdown on the 9th and the 10th of March. There was no plan for stopping all of these things. So if you're not going, then you can see the kind of twisted logic of, well, don't stop things like Cheltenham or football matches and everything else.
On the 11th of March, you sent a WhatsApp message, 102697, page 17, where you say in the middle of the page, I think it's really important that senior people understand and are able to discuss with Prime Minister this fundamental question. All sensible people can see the trajectory and how social distancing will be needed to flatten the curve. Very sensible people. People are saying the risks of delay are much higher than the risks of going too soon. And then you say in capital letters a little further down the page, why wait 5 days? Why not move now and flatten the curve earlier?
Yeah.
Was your appeal heard, Mr. Cummings?
No.
Why not?
It's a very complex question to which I don't have a clear answer. I think, well, obviously, at this point, SAGE people are still going on TV saying, well, the plan is herd immunity and it makes sense. So the fundamental Plan A strategy was in place on the 11th. But there was also at this point this concept of, quote, behavioural fatigue, unquote, that people kept referring to. And I think this is a really critical question.
Well, then just pause there. On behavioural fatigue, what was the genesis of this notion that if you went too early, people would struggle to sustain their commitment?
So we were told, the PM was told and I was told in this week that it came from SAGE and Spy B. However, obviously, since then, SAGE and Spy B people have all rushed to try and claim that it was not me. So I don't think it's actually been, I don't know what the answer to this is. What I do know is that Patrick and Chris talked about this concept in this week, and this was another red flag for some of us in number 10, because of course some of us had worked on political campaigns and we knew that an awful lot of stuff coming from so-called, quote, behavioural scientists, unquote, turned out to be dodgy science and dodgy papers and dodgy concepts. So we were worried about this, but in that week, a critical meme that kept being repeated was, this has to be done at the right time, this has to be done at the right time.
When you say the PM was told and I was told, so that we are clear, Mr. Cummings, who told you that there was a problem with maintaining commitment?
This was referred to by Patrick and by Chris in their briefings in the PM's office, though they said that this had come from Sage. And of course they referred to it publicly in various documents.
This was all intimately bound up, of course, with the understanding of herd immunity, the one-way strategy. You've got to allow parts of the population to become infected. That will reduce the risk of an uncoiled second wave and so on and so forth. And at the same time, This idea took hold that you couldn't go too soon because whatever measures were put in place were unsustainable.
So, A, that they might be unsustainable, but B, remember the fundamental distinction that if you're going for a single peak strategy, then they didn't want to go too soon because that would actually suppress things and then the thing would just pop back up straight away.
Indeed.
And that's why when you asked, was my question properly answered? In the all caps here, why not move now and flatten curve earlier? That logic is the logic of Gowers and Hassabis and the Warners. That logic is the logic of if you are actually not going to do a single peak, if you are actually going to try and control it and suppress it now, then the simple logic of exponential curves means that, of course, the sooner you do it, the better. But that was not what the planning assumption was on the 11th.
Were you readily persuaded that the herd immunity approach, or rather the one-wave strategy, was the wrong way to go?
It's obviously very hard to reconstruct psychology exactly, but I would say that by this time of so certainly in the week of the 9th, 10th, 11th, I had growing doubts on an hourly basis. By the 11th, I was pretty much so by the 11th, my view was, I've got an appalling feeling that I'm in one of those like historic catastrophes like July 1914. I'm not completely sure of it, but I've got some very smart people coming to me saying this is fundamentally the strategy is wrong, misconceived, but also at a practical level at this point, remember, I was sitting in an office and suddenly overhearing people having phone calls about whether local authorities could book out ice rinks and get trucks to carry massive numbers of bodies and store them in ice rinks. These conversations suddenly exploded in the week of the 9th in number 10. So we had on the one hand a fundamental argument, is the strategy misconceived or not? But we also had this sort of growing cascade of nightmare conversations going on around us when we realised that the system was just completely out of control in terms of coping with its original Plan A.
Could we have 173144, please, on the screen, page 1? Mr. Hancock, in a WhatsApp message with Damon Poole, dated the 23rd of May, says, herd immunity was never the government strategy, but it was what Dom was pushing until he was finally persuaded to drop it in early March. Is that a fair assessment?
Well, it's obviously laughable.
When did it become apparent that modelling may not have been necessary in order to drive home the point that with the number of deaths and hospital cases that were the inevitable result of the infection fatality rate and the hospitalisation rate, the healthcare system would be likely to be overwhelmed?
So Mark and Ben Warner raised this with me from a kind of week before this point of the 10th, 11th of March. But when it really came home very starkly was after I asked, I think on the Monday, Imran, but somehow between us anyway, Imran and I asked the NHS to provide their data, which for some odd reason hadn't come through. And there's references to that between Warner and Vallance as well. That data arrived, and I asked to get Simon Stevens in to present it, which I think happened on the 12th. All the records are a bit iffy on that day for reasons that you're aware of. but when we saw these NHS documents, and Mark Warner explained the background of it, that's what really made things incredibly stark, because you suddenly had these two completely divergent sets of graphs, one from the NHS and one from the COBRA system.
On the 12th, there was a cabinet meeting. On the 11th of March, there was a cabinet meeting, 56132. At page 4, the Secretary of State for Health and Social Care said this to Cabinet. You can see about 2/3 of the way down the page. Without these symptoms, the symptoms of a dry cough and a temperature, it was highly unlikely that someone was suffering from coronavirus. By the 11th of March, was it generally well understood in Downing Street that a large percentage, a large proportion of this disease for the viral spread, in fact, was transmitted asymptomatically?
It was, and Mr. Hancock had made this point in multiple ways, and sowed chaos by saying this. He was repeatedly told by Patrick Vallance that what he was saying was wrong, but he kept saying it. He said it here, and if you notice, it makes its way into statements that have been provided to this inquiry. So this false meme lodged itself in crucial people's minds. I don't understand, never understood why Hancock said this, but Patrick Vallance made extremely clear to me and to others in Number 10 that what Hancock was saying was factually wrong.
On the 12th of March, you messaged the Prime Minister raising concerns. Part of the message was put to Mr. Kane earlier in the course of evidence, but I'd like it back, please, on the screen. 48313, page 22. You see there the 12th of March date. This is the reference to the need to chair daily meetings in the Cabinet Room. If you could then go over the page, please, to page 23. The overwhelming danger here is being late and the NHS implodes like zombie apocalypse film, not being a week early. What did you mean by that?
So, you mean the last message?
Yes.
Well, at this point, we'd got the data that I'd asked for from the NHS, and we'd seen these graphs. And it was clear, it made starker not only the scale of the problem, but also two things. A, that the whole crisis was coming much, much, much faster than we had been told, and that the Cabinet Office understood, and that was on all of these official graphs. And secondly, to me, almost worse than this was, like, what on earth is going on? Like, how can we be in a situation where the NHS has these graphs showing that we are days away from having to make a decision on what to do to stop this nightmare, but the official system in the Cabinet Office for dealing with this crisis doesn't seem to understand this. So it wasn't just the kind of first order level of how bad it was also the second order level of what on earth is going on in the system that this could be possible.
On page 69 of 48313, there is a WhatsApp message from you saying, said while babbling about chickenpox, God fucking help us. What was being said about chickenpox, Mr. Cummings?
So there was a meeting in the PM study roughly noon on this day. And there was a conversation, and in the conversation, the Cabinet Secretary said to the PM, you should go on TV and you should explain that, this is like the old days with chickenpox and people are going to have chickenpox parties. And the sooner a lot of people get this and get it over with, the better, sort of thing. And this has been mentioned before, this analogy, and I said, Mark, you should stop using this analogy of chickenpox parties, and the Cabinet Secretary said, why? And Ben Warner said, because chickenpox doesn't spread exponentially and kill thousands and thousands of people. And the look on people's faces when Ben said this, that was quite a crystallizing moment, because it made us, A, think, who on earth is briefing the most important official in the country along these lines? This is terrifying. But also other officials obviously heard this exchange, and some of them came to us and said, essentially, like, something has gone terribly wrong in the Cabinet Office.
All right. On Friday the 13th of March, the inquiry understands that, of course, there was the meeting in the evening involving yourself and others, at which a plan B, to use your wording, was sketched out on a whiteboard. It's at 48313, page 3. If you could just scroll in, please, we can reacquaint ourselves with this whiteboard. Essentially, Mr. Cummings, and if you would just simply confirm yes or no, this whiteboard was the first emanation of Plan B, which recognised that to stop the NHS collapsing, there would have to be consideration probably of a lockdown. And of course, it deals with the number of deaths that would occur in a reasonable worst case scenario. It deals with issues as to how you deal with contact, what the differences are between Plan A and B, who not to save, i.e. who is at risk, and full lockdown before collapse.
Yeah.
And this whiteboard is moved around Downing Street, I think, like Theseus' ship. It's brought into meetings and it's further explained to the Prime Minister and individuals there.
Yeah.
During the course of that meeting, though, the Prime Minister texted you and Mr. Hancock, Sir Patrick Vallance and Sir Chris Whitty, saying, how do we win the herd immunity argument?
Mm-hmm.
Was that because, notwithstanding the information which had been received from the scientists, from Professor Ferguson, from the NHS, your incipient understanding of the wave of death that was to ensue, it was still thought in number 10 Downing Street that herd immunity was the way forward?
Yes, but at this point on Friday evening, 13th of March, Plan A remained Plan A. And also, of course, what the PM's specifically referring to is, at that point in that week, multiple scientists, including the CSA and John Edmonds, had been on TV explaining the herd immunity the herd immunity basic Plan A. But there'd been a lot of pushback from it. The PM was nervy and was saying, you know, how are we going to explain this better, and how are we going to get this argument out?
All right. The next day, on the Saturday, there were a number of meetings. There was also a long debate on WhatsApp between the Chief Scientific Advisor, the Chief Medical Officer, Mr. Hancock, the Prime Minister, and yourself. Could we have 48399? And I don't want to spend too much time on this WhatsApp thread, but it shows on pages 3, 4, and 6 a fairly extensive debate about how herd immunity as an argument can still be advanced, if it is to be advanced at all, but also how concentration now needs to be focused on measures to be taken to avoid transmission and save lives. And I think on page 3, 1403, the 14th of March at 7:39, Mr. Johnson says, thank you, agreed totally with above. That's why I was concerned when some on the team were suggesting last week that we actively need a proportion of population to be infected. And if you could just scroll back out. Civil service need to grasp. So the Prime Minister understood that there was a problem here with whether or not the system, as you would describe it, or the civil service, as he would describe it, understood the danger, understood the need for a change in strategy, the need to understand that there was no time to be lost.
I think that's oversimplifying things, if I may say so respectfully. If you look at the chronology, some of these messages start early in the morning, and some of these messages are in the evening. And an awful lot happened that day. You know, in the morning, the PM is still essentially in Plan A mode. Then there is a meeting that I organised. There's an official meeting, and then there's a second meeting. And the situation, I think, what the PM's mind and other people's minds, including Patrick, were very different, even in this between morning and evening on this day. It was a day of kind of psychological transition for a lot of people.
The whole thread shows that evolution in thinking. If we could go to page 6, we can see at 10:49 a.m. Mr. Johnson says, no time. Although I now can't see it. Yes, thank you very much. 10:49, 15 seconds. Johnson, Boris, seeing what happened in Italy, we simply have, in capital letters, no time. Over that weekend of the 14th and 15th, there are, as I said, a number of meetings. Sage is asked to model lockdown. You're in touch with Timothy Gowers to ask him for his help, and he says you've got to move urgently to extreme containment measures, correct?
Yep.
253942, page 3. You asked him for his views, and he says you've got to move urgently to extreme containment measures. There we are, about a third of the way down the page. I now think that we should move urgently to extreme containment measures. Then, on that Saturday, the 14th of March, at the officials' meeting in the morning, Number 10 was informed that matters, the outbreak was further along the curve than had been thought. And there was a private meeting, was there not, between 9:01 and 9:10 with the Prime Minister, yourself, Cleo Watson, Lee Kane, Imran Shafi and Stuart Glasborough, where you wheeled in your whiteboard and you took the Prime Minister through the problem.
Yep.
In light of what Mr. Kane said earlier, can you make plain, please, though, that it doesn't appear as if any decision was made during the course of the weekend for a lockdown. It is that there was a change in the strategic approach of the government. There was a realisation that there had to be a change of approach and much more stringent measures were likely to be required, but no actual decision was made to impose a national lockdown.
Correct. That the way I would describe it is that we had the conversation with the PM on the Saturday morning. We told him our concerns that Plan A was heading for a catastrophe. I then, after that, spoke to Patrick Vallance and articulated my concerns and my ideas about a Plan B that was sketched on the whiteboard. Patrick Vallance had clearly changed his mind in various ways as well, as I referred to in my text with the PM. And I agreed with Patrick that we would organise a meeting on this Sunday at which he and I jointly would try to articulate a different way forward. But I was very keen for him to do this rather than me, for obvious reasons.
And to be clear, at the morning meeting on the 14th, on the Saturday, you said need to do in the next 72 hours to avoid NHS lockdown. And there was a debate, including Michael Gove MP, in which he said, go now. Mm-hmm. We know that from the notes of that meeting kept by Mr. Shafi.
Yes, I remember him saying it. I remember Gove saying that, sorry.
On the Sunday, and in fact throughout the weekend and then onwards on the Monday, there was a considerable debate also in a WhatsApp group titled CSA, CMO, MAT, PM, DOM, concerning the need to accelerate the social distancing plans. In essence, do you agree?
Yes.
And there was a debate, including Mr. Hancock, about the need to ramp up testing, not stop testing, a need to continue contact tracing and introduce self-contact tracing. And I think he assured you at 7:30 on the 14th of March that both of those were in hand. Do you recall?
Vaguely, yes.
On the Sunday, there were further meetings, and the Prime Minister held a meeting with his closest advisers in which you'd summarised the discussion from the day before and about the need to move to Plan B. Was a decision about the government's approach able to be taken at that meeting, or did the Prime Minister want to confer further with the Chief Medical Officer and the governmental Chief Scientific Advisor?
So I'm not exactly sure which meeting you referred to. You said Sunday.
On the Sunday.
Yeah, on the Sunday they were. So on the Sunday, I met with Patrick and Chris, certainly with Patrick, possibly with Chris, before the meeting with the PM. Then at the 5 o'clock, I think it was, that meeting was with Patrick and with the PM.
At that meeting, did anybody express anger or irritation or annoyance at the view then being expressed by Sir Patrick Vallance as to the need to change course?
I would say there was a great deal of confusion at that meeting, because in terms of the reactions to it, because of course Patrick and I were essentially suggesting that the original herd immunity plan had to be ditched. There was anger after that meeting expressed by people in the Cabinet Office and at DHSC, reflecting the fact that they were essentially blindsided. Of course, as far as they knew, as far as the people in the Cabinet Office and DHSC knew, Plan A was still in place. Plan A was still in place. As you can see from the record, Matt Hancock said on the Saturday morning on the 14th to the official meeting, we've got to, quote, stick with the plan, unquote. So when Patrick and I, wheeled in whiteboards and said, essentially, we've got to go down a different route on the Sunday evening, I was told after that Patrick Vallance was reprimanded by various people and that there was a very angry reaction in the Cabinet Office and DH.
In particular, was he reprimanded by the Permanent Secretary at the DHSE for having, as the Permanent Secretary appeared to think, advocated a change of direction without the Permanent Secretary's knowledge?
That is my understanding. And you can see from messages on the 18th that the Permanent Secretary at DH still was behind the curve on this whole discussion. Because
he was still talking about one-wave strategy, talking about why the NHS would be overtopped, to use his word.
Correct, on the afternoon of the 18th. So I think, just for complete clarity, it's a big mistake to think that there was a kind of clear moment. Right? This was all complete chaos. There was informal meetings on the Friday. There was formal and informal meetings on the Saturday. There was formal and informal meetings on the Sunday. There was Patrick and I basically articulating a plan B. There's the PM thinking about it. There's the Cabinet Secretary and other people in the system suddenly going, what the hell's going on? Are we ditching Plan A? What the hell? So it's important not to think that there was a sort of, that this was all very clear and then suddenly everyone left the meeting and everyone was aligned. It was a very chaotic process, that transition.
So chaotic was it that data and whiteboards and information that you were using to make your point were themselves out of date. So if we could have 48313, your letter to the inquiry at page 39. This is a screenshot that you've provided of charts from the NHS showing how beds, that the bed capacity of the NHS would be overwhelmed.
Yeah.
That information, it'll be page 40 then, please. I think I must have got the wrong reference. There are NHS graphs which were shown to you and which you deployed in order to show the crisis facing the NHS that weekend, in which the peak on those graphs was still being shown as being in June of 2020. So
no, that's slightly confused. There's two different sets of graphs. There is a set of graphs that came from COBRA and CCS, which was showing the peak in June at this time. The NHS graphs, which we've been provided by either NHS or essentially from Stephen's office, the ones I referred to earlier, which were shown to us on the Thursday the 12th. If you look at the photo of me in the room with the PM on Saturday the 14th, you can see those NHS graphs are the ones that are in front of him. So part of what that meeting was about was showing him, here's what the Cabinet Office and the CCS are all planning on the basis of, and DHSC. But here is the actual NHS graphs, which Stevens has provided and which the Warners are saying is much more accurate. These completely mismatch.
Because the first set of graphs showed and continued to show that the peak would be in June. And of course, information had by then already been received in Downing Street that we were way off the trajectory, it was coming sooner than expected.
Correct. And as a measure of how bad that was, even after this was realised and we had these conversations and we were saying to people, these are the graphs from the NHS, these CCS graphs are completely wrong from COBRA. These graphs kept appearing in the briefing pack for 2 more weeks after this. So it was kind of, somehow it got embedded in the system and it was very hard to de-embed it. If they were still appearing after we'd even decided to make to do the first lockdown.
All right. Now, during the course of that week, commencing on Monday, the 16th of March, there were urgent debates and there was rapid consideration of the need to shut schools, which you called for in a number of texts and messages. You called for London to be locked down to stop the NHS collapse in London in 15 days. There was obviously an extensive debate about whether or not practically a lockdown could be put into place, as well as whether it should be national or London first and then the rest of the country behind that. What was the Prime Minister's general position in relation to whether or not this was a course that would have to be contemplated and pursued?
He oscillated through the course of the week. I think that he, like me, in the week of the 9th, his bat sense was telling him that something had gone wrong. I think he'd been very alarmed by the chickenpox parties. When he heard the most senior official in the country use this, it wasn't a blame about Mark, but it was some signal that who the hell was briefing Mark this ideas like this. So he was concerned. When we talked him through on Saturday and said we've got to ditch plan A and shift to plan B and try and build our way out of it, he was certainly open, but like me and like the Warners and others, he was somewhat dumbstruck that we were in this situation. And of course, there was no plan for lockdown. So he was also perfectly reasonably saying, how the hell do we lock down when there isn't a plan for lockdown? And I've been told for the last 8 weeks that A, lockdown is impossible, B, lockdown is mad because it just means an even worse second wave. Now suddenly you and others are saying we're going to have to lock down. What the hell's going on? In your statement, you refer to a number of difficult discussions with the Prime Minister because of the way in which he swung. He backed and veered from taking the view that there had to be a lockdown to taking the view that there should not. Were those careful and measured considerations of the options, or were they, to use your language, wild oscillations and trolleying? Well, I think, to be fair to the PM, it's hard to overstate. The last time anyone had been in that building in a situation like that was literally Churchill. It was an extraordinary situation, and the PM had repeatedly, extraordinary meetings. So he suddenly had the Cabinet Secretary coming in saying, are you absolutely sure about this? The Cabinet are going to revolt. This is all going to kick off. He had the Chancellor come in and say the bond markets might puke and we might have a massive 2008-style financial crisis with the perm sec from the Treasury. Slow down, Mr. Cummings, please. There were a lot of crazy things of people suddenly just coming into his study saying wildly different things. Right. So, although I have been very critical of him, I think it's important to understand in this context that he was being buffeted very strongly by different forces. There was me and one set of people making one argument that we'd basically been kiboshed by disastrous groupthink and we had to change path. He had people in the Cabinet Office saying that, he had people in the Cabinet saying the other, and he had the Treasury people warning him that if we went down this path, then we might provoke another parallel disaster. And as the days unfolded, he backed and veered from supporting a lockdown to being incredibly concerned about the prospect of ordering a lockdown. On the 19th of March, a bilateral meeting with the Chancellor of the Exchequer took place, and the inquiries received evidence that somebody said at that meeting, we're killing the patient to tackle the tumour, large numbers of people who will die. Why are we destroying everything for people who will die anyway soon? Who said that, Mr. Cummings? I think it was the PM. And was that a reflection of the agonising debate which was going on in Downing Street? Yes, and a reflection of the fact that the Treasury were pushing back against, the Treasury were kind of baffled as to what's going on. We had a plan, why are we not sticking to it?
But the Chancellor wasn't trying to stop serious action being taken, from your own statement, that's what you say. But you sent emails or WhatsApps to Mr. Kane, we saw those earlier this morning, saying, get in here, he's melting down, he's back to Jaws mode. I've said the same thing to him 10 fucking times, and there's references to stopping the trolley. So it does appear, Mr. Cummings, that there was a very real problem in getting the Prime Minister to agree to a course of action and to stick to it. Is that the nub of it?
It is the nub of it. Also, I think by the 19th, it's important to realise that there'd been a huge swing in the kind of institutional weight. So if you go back a week prior to the 19th, the whole weight of the machine was behind Plan A. By the time you get to the 19th, the whole weight of the machine had shifted, and this was sort of cascading through the system of, hang on, we cannot do Plan A. Obviously, when you look at what Plan A means and also how fast it's all going to unfold, we've got to shift. So there was a sort of huge institutional shift over the course of that week. And part of what I was referring to in that message was, by the 19th, it was totally obvious that there was going to be a lockdown. And my fear then was that if the PM suddenly trolleyed back, then all it would do was cause more needless confusion. If you imagine how hard it was to ditch Plan A and shift to Plan B, if the PM had then started saying to key people, oh, hang on, we might move back to Plan A again, we were all holding our heads.
And it would cause more delay.
Yes.
There was a debate about whether or not London should be locked down. The Prime Minister met with the Mayor of London and they agreed to jointly announce that entertainment, hospitality and retail must close in London from Friday. But the Prime Minister changed his mind again and that announcement did not take place and London was, of course, not shut down early. The position then by the following weekend, the weekend of the 21st and 22nd of March, was that time was allowed to see whether or not the measures which had been put in place that week would work, whether or not there would be sufficient compliance. And it became apparent, didn't it, over the weekend, that from continued social mixing up and down the land, those measures were simply not going to work. And that is why the lockdown decision was made on the Monday.
Yes, I mean, if I recall correctly, again, I would say that might have been formally made on the Monday, but I think it was pretty clear over that weekend that it was going to happen before.
There were meetings on the Sunday, and the matter obviously formally had to be debated by Cabinet.
Yeah.
And the Cabinet meeting took place on the Monday. And for all those reasons, Mr. Cummings, is that why you say in your statement, in effect, that had proper preparations been made, had a proper border and test and trace system been in place, there may never have been a need for a lockdown, but that it became necessary as the weeks in March moved on to stop the NHS collapsing. Is that the nub of it?
It is the nub of it.
If there had been a scaled-up test and trace system from January or February, then control over the virus would not have been lost. Yes?
Possibly, but I think it would to do it properly. You would also need industrial manufacturing and scaling up rapid tests as well.
Yes. When I say scaled-up test and trace, I mean a sophisticated, scaled-up, rapid TTI contact system. And control having been lost, Mr. Cummings, there is obviously an argument that that lockdown, which became necessary to avoid the collapse in the NHS and to prevent death, could have been decided upon earlier than it was.
For sure.
And it was the way in which the government system, the structure, attempted to change direction from the 9th of March onwards and the lack of any planning or preparation for shielding or any of the other parts of the system that would be required to accommodate a lockdown, that a lockdown could not be imposed earlier?
Yes, there wasn't an operational plan for it or a legal plan for it or all the sort of thinking through of what it would actually mean.
With hindsight, Mr. Johnson's view varied between, particularly before he became ill, concern that the government had overreacted. He was concerned because he said, I've no idea whether COVID is killing people. I don't know how many COVID deaths are truly additional. Did we really have to take those steps? But after he fell very gravely ill and recovered, he told you, this thing is no joke. Thank God we changed course. It would have been a catastrophe.
Correct.
Over the course of the months after the lockdown, the government backed and veered, in no small part due to the Prime Minister himself, as to the extent to which the system should be allowed to open up and the extent to which it should be kept controlled. And that debate raged, did it not, throughout the summer months?
Yep.
And is that the time at which you and other members of Number 10 engage with Mr. Hancock, particularly on the issue of the way in which the testing system was then becoming designed and put into place, the way in which the care home sector was being protected, adequately or not, and the way in which steps have been taken to try to get in sufficient quantities of PPE?
Yes, after I came back from having the disease myself, from roughly the 13th of April, we discussed extensively in the Cabinet room all of those things, how to build test and trace, how to build the infrastructure, PPE and everything else. Also, how to create a vaccine task force. I mean, many dozens of such things.
The detail of test and trace and of the care home sector and of PPE are for later exploration in later modules. So I don't want to go in detail, but was it around that time that you sent multiple emails and WhatsApps and messages to Mr. Johnson and others stating that your belief was that you were being misled by Mr. Hancock, misled by the DHSC in relation to assertions as to what was being done to protect the care home sector, what was being done to ramp up testing, and what was being done to get inadequate supplies of PPE?
Yes, multiple officials, including Mr. Shinner and an excellent private secretary, Alexandra Burns, raised issues with me that they thought that what was being said in the morning meetings about those issues was not accurate. And I tried to convey this to the PM, as to be fair to him, also, as Mark said, what the Cabinet Secretary did.
Could we have 48313, page 16? This is an extract from your letter to the inquiry dated the 7th of May. You say that Mr. Hancock is unfit for this job, the incompetence, the constant lies, the obsession with media bullshit over doing his job. Still no fucking serious testing in care homes. His uselessness is still killing God knows how many. This morning are you addressing this to Mr. Johnson?
Yes.
Must ask him when we will get to 500,000. Is that tests per
Correct.
day? And where is your plan for testing all care home workers weekly?
Yes.
If you could go, please, scroll out and go to the bottom of that page, and then scroll in on the last entry. You need to think through timing of binning Hancock. There's no way the guy can stay. He's lied his way through this and killed people, and dozens of people have seen it. Was it around this time, in fact on the 15th of May, that Mr. Hancock said, we've tried to throw a protective ring around our care homes?
I believe so. You have the date. I'm sure you're right.
And was it around this time, therefore, that in Number 10 there was repeated consideration to the issue of sacking Mr. Hancock?
Yes, and I also had complaints from officials to me, entirely rightly. The Cabinet Secretary said to me himself, the British system does not work if ministers lie at the Cabinet table, and you have to convey this to the PM. I think the Cabinet Secretary was completely right. There was only so much that he could do. This was fundamentally a political matter, and I did what I could.
Lord Sedwell said in a WhatsApp on the 18th of April, Hancock is quite slippery in all this. That was in the context of PPE. And on the 20th of April, Mark Sedwell referred to, I'm fast losing confidence in Hancock's candour as well as grip. We'll have that on the screen, please. 48313, page 26.
Yes, that's the sort of conversations that I was referring to. But we had, I mean, it wasn't just on WhatsApp, we had face-to-face discussions along those lines.
If you could scroll in, please. It's quite hard to read, but you can see in the top third of the page, that exchange really worries me and reinforces the need to get a grip on DHSE, who should have been kicking my door down over this for weeks to get it resolved.
Yeah.
I'm fast losing confidence in his candour. But Mr. Hancock was not sacked. But there was a significant change in Downing Street, because on the 14th of May, the Prime Minister called Mark Sedwell, the Cabinet Secretary, into his study, and at a meeting attended only by Mark Sedwell and Boris Johnson, Mr. Sedwell was effectively told that his time was up. He ended up staying till September, but that his role as Cabinet Secretary was effectively over.
Yes, this was one of the most disastrous moments of the entire 2020 because it set off a kind of bomb across the whole system. I begged the PM not to do it. I knew what would happen. The same as every single HR conversation you ever had with anybody, it was a total disaster. And it was also, I mean, from a personal level, it was very unfair on Mark. But from a government level, it kind of kicked off week after week after week of debilitating argument across the system instead of actually rebuilding the system, which is what needed to happen.
But you had, of course, put poison into your master's ear because you had described Mr. Sedwell as, well, you'd insulted him, you'd told the Prime Minister he was off the pace, he was not up to the job. In a WhatsApp on the 14th of March, you said to Mr. Johnson, that fucker, Mr. Sedwell, should be in the office. You played your part in the loss of confidence, did you not?
Yes, I did. But so I think you have to separate out two fundamental questions. It was my job to convey to the PM that the Cabinet Office structure, which was the engine room for dealing with a crisis like this, had blown up and could not cope. And I think I was right in pointing out to him multiple problems. That's completely different from the way in which the PM then tried to handle the whole situation, which obviously should have been handled in a completely different way. The way he handled things with Mark, and then almost immediately afterwards, he did practically identically the same thing with Helen. It just caused absolute chaos.
Are you implying that Mr. Johnson treated Helen McNamara in a way that you would not have done?
Well, I mean, so there's a huge...
Yes or no, Mr. Cummings?
Yes.
Helen McNamara...
In a fundamental way...
Excuse me.
Do you want me to explain why
no,
or not?
I'd like you to listen to the question, please. Helen McNamara and Martin Reynolds produced a report which identified toxic cultural problems in Number 10, people talking over junior women, sexist macho culture, and they describe a pretty unpleasant working atmosphere in Number 10. Had you contributed to that toxic atmosphere, Mr. Cummings?
I contributed to... So, certainly the atmosphere was toxic in all sorts of ways. I contributed to it in the sense of I'd said that the system's broken, a lot of the people need to be removed and it needs to be rebuilt. This was extremely unpopular this was very popular with some officials. It was extremely unpopular with other officials, in particular Martin. There was, though, I would stress, a lot of support. A lot of very good officials had seen the collapse of the Cabinet Office up close. There was a lot of support for my view, which was that it needed fundamental root and branch change.
My question was, had you contributed to that toxic atmosphere? Is your answer yes?
No, my answer is not yes. If you're trying to suggest that that an overall the way that you characterise it, no, I think that explaining to the PM and others directly, these are the problems. We can't carry on like this. Crucial people need to be removed. Here's what's wrong with it. Here's how we rebuild it. Did that contribute to bad relations? Undoubtedly, yes, with some people, but it was necessary and justified.
Did you treat individuals in Downing Street with offence and misogyny, Mr. Cummings?
Certainly not.
Could we have 283369, please, an extract from Mr. Johnson's Fight Back WhatsApp group? Page 37. Just to pick up the thread of the chronology, if you could scroll in on the top of the page. We could see that the first WhatsApp is the 21st of August, 2020. Mr. Johnson says the mail has fucked up remnants of my Scottish break, so back in Chequers and in a thoroughly homicidal mood. We need a plan for the Department of Education, PermSec, better ministers, reform. There is then some communication between him and Mr. Kane and you at the bottom of the page. And then over the page, please, to page 38. You say this at 12:20. If I have to come back to Helen's bullshit with PET, was that propriety and ethics?
Yes.
Part of the Cabinet Office, or number 10. Designed to waste huge amounts of my time so I can't spend it on other stuff, I'll personally handcuff her and escort her from the building. Had you got form, Mr. Cummings, for arranging for people to be escorted from number 10 before?
You shouldn't believe everything you read in the newspapers. That story is not accurate.
I don't care how it's done, but that woman must be out of our hair. We cannot keep dealing with this horrific meltdown of the British state while dodging stilettos from that cunt. Page 10 of 283282. We got to get Helen out of cab off. She's fucking up Frosty. She's fucking up me and Case. She's trying to get Spads fired and cause trouble on multiple fronts. Can we get her in Monday for chat re her moving to community local government or DFT Department for Trade? We need her out ASAP, building millions of lovely houses. If you go back one page to page 7, please. 3 pages in the same document, we will see a way in which you speak of a professional scientist who gave his time and considerable amounts of energy to SAGE, Professor Neil Ferguson. A third of the way down, we should get someone to hammer Ferguson. Mr. Cummings, was that aggressive and foul-mouthed and misogynistic approach the correct way to manage fellow professionals?
I don't know what the Ferguson thing is referring to, but in terms of Helen and the situation in the Cabinet Office, you need to understand that the Prime Minister had, first of all, tried to sack the Cabinet Secretary and then botched it, and he was still there. Then he'd said to everyone that he wanted Helen to be removed as well and that he'd lost confidence in Helen. The new Cabinet Secretary had said that he wanted to have the authority to change both the PPS and choose his deputy, i.e. Helen. The Prime Minister had then trolleyed back on this as well. So we were in this absolutely nightmare situation where the PM had made clear that he didn't have confidence in either of the two senior officials, had said to people he was going to remove them, then he didn't remove them for week after week. This led to an absolutely nightmare situation. Now, my language about Helen is, the language is obviously appalling, and actually I got on well with Helen at a personal level. But 1,000 times worse than my bad language is the underlying issue at stake, that we had a Cabinet Office system that had completely melted, and the Prime Minister had half begun the process of changing the senior management and then stopped. So me and other people were desperately trying to build a new system with a new Cabinet Secretary over this period in order to get ready for September. And then suddenly we were getting dragged out of meetings on things like test and trace and vaccines to be told that we had to deal with Cabinet Office HR issues and legal questions regarding judicial reviews and jolly on morn. This is, I mean, Kafkaesque nightmare doesn't even begin to explain it. So I apologise for my language towards Helen, but 1,000 times worse than my language was the underlying insanity of the situation in number 10.
When this morning...
Keith, I'm sorry to interrupt, but I think we have to take a 5 minute break.
Yes, of course.
So I'll be back at 25 to. All right. So it's not 5 minutes.